Apparently I'm doubled. I don't know, there's another joined here with my name and it's not me. Okay, let's just hope it's not some Putin spying on me, because if he
I
does.
think it's me, Misha. I think I accidentally
Okay,
used
well
your link. Yeah.
that's good. That's my better half out there. Okay, very good. Okay, so I have two quick topics from today. You know the drill, questions in the chat or just raise your hand. You'll know how to do that. If not, just unmute yourself. So let me share this first interesting piece of news. So we recently learned that GW had appointed Dr. Nesbitt as the first inaugural dean of the population health. So Dean Nesbitt is coming to us from Center for Medicare and Medicaid, where she was one of the most senior directors. So it's a very good gain for GW. I'm not sure about the loss for CMS, but I'm not going to comment on that. And so Dean's Nesbitt, one of the big interests is to try to bring value-based care and whole person care to GW. So she and I had a very good meeting today. I'll keep everybody posted about how that's moving inside the university. And with that, I will transition quickly to a quick update on long COVID. I'm going to put my YouTube video into the channel in a chat in a second. So a couple of days ago, well, actually, a study has been published a little bit further out on use of 3 drugs, and that is ivermectin, fluoxetine, and metformin for prevention of long COVID. This is my take on this study. So that's a YouTube video. By all means, subscribe if you haven't subscribed to my channel yet. And the link to the study is inside, but I'll give it to you now too. And that is, it's preprint, so it's not the actual publication yet. If anybody is interested in details of the study, I am more than happy to review it. But in short, of course, ivermectin and fluoxetine, we already knew it does nothing except side effects. It doesn't treat anything, whether it's active COVID or preventing any complications of COVID. But to my surprise, metformin actually turned out to be quite beneficial. It cut down long COVID risk by more than 40%, or roughly, I think, 43%. Which is not a small change. Now, I will comment on the fact that, of course, most of the patients in the study who were analyzed had most recent Omicron strain. However, they did analyze Omicron variant, and the metformin performed just as well in Omicron as it performed in prior strains. Very important point is that the study population was on average very overweight. The BMI on average was more than 30, which I find a little unusual for an average study. And I'm guessing that's why they saw such a dramatic benefit. 40% reduction in long COVID to me is quite dramatic. Of course, you should ask immediate question. Now, what about me? If my BMI is high and if I get COVID, should I take metformin for 14 days? And I'm starting to lean immediately forward to say yes, absolutely, because the study was large enough. It was well randomized. There was no real serious side effects. The titration is very simple. The drug is covered by insurance. If it's not, it's very cheap. It's a very old drug. And generally, I have a lot of my patients on this medication, not just for diabetes, but also for cancer, and even some patients who take this drug for longevity, as there is some data out there to say that potentially this drug delays mortality. So it's used as anti-aging drug. So with that, that's all I have for my updates for today. So let's turn to chat. Thank you, Janet, so much for putting a detailed explanation of what population health is. I probably should have said what that is, right? Okay. Okay, I don't see any questions, so you usually take a little time. Okay, Sheila.
I just want to talk in. When you say long COVID, is this happening after the Paxlovid has, treatment has come out, and you kind of get through?
Okay, that's a great question. So this study, more than none of the patients who were in this study, this was pre-Paxlovid, but they had some population that was after Paxlovid. It didn't really change the prevention strategy, meaning that if you taken Paxlovid and metformin in combination, the effect was almost just as good. And what we do know that I think their total average of patients who did not take metformin who developed long COVID by their definition was 10%. And then in the metformin group, it dropped down by 4.2 or 42% to just around 6 or something. And so it's a little probably high, the total of 10 to, I think, what was happening now. I think now we're a little bit less than 10% on average of everybody who gets COVID. And I think the frequency of the long COVID is going to keep slowly going down as we move forward, and more people are getting immune and had it once or twice. So interestingly, I had another study that I was going to present, but I'm going to hold off of that till next time. That's unfortunately studies showing that even most recent patients who get COVID, significant amount of people with that is going to develop long-term cognitive consequences. This study just came out, so I'll review that for next Friday.
So another question, your clinic, your long COVID clinic, is that primarily patients who, like the first few years when everything was really bad?
That's right.
Those patients
that's the majority of our patients.
Okay, that's what I was trying to find out.
We have few who came through for different periods of time who had newer infections, like in the last, I say, 18 months. But most patients are struggling now for several years with that. And those patients tend to generally they had much worse episodes in the beginning of actual COVID. And I think there's definitely correlation between the worse the COVID is, the more likely you to develop the long COVID. Now, that doesn't mean that there's no patients who had a very mild disease and then were stricken with long COVID. We've seen that too. So it's kind of all over the place.
All right, thank you.
Great question. Thank you. Okay. All right. No other questions? Wow. Small interest today. Very good. Well, with that, I'm ahead of time, which is great. It'll give more time for Nyle. Thanks so much for coming in, as always.
Thank you, Dr. Kogan. Hi, everyone. So, my name is Nyle, and my background is as an occupational therapist. I started in geriatrics, actually, and now I work primarily in private practice, working with the mind-body connection. So I'm here today to talk to you about how to create an integrated embodiment practice. And what that means to me, integrated meaning that it mimics your daily routines in some way already, so that when you add it to your life, it only adds to your life. It only makes your life easier. It doesn't feel like a thing that you have to sacrifice anything that you're already doing. It doesn't, it kind of positively reinforces the participation in it by you getting to see how your function increases. The other piece of it is that it's realistic. I'm not going to ask you to completely overhaul your daily practice in order to add these tools that I'm going to show you today. And so an embodiment practice. So that's what I'm going to show you, and I'll pull up a slide in a minute. But for those who may not know what an embodiment practice is, and that word embodiment can mean a lot of different things to a lot of different people, I want to get really clear on the definition of what embodiment means to me. As an embodiment practitioner, what I focus on with bringing embodiment to my client base is what is their relationship to the whole self. So embodiment looks at your relationship to your physical body, your spiritual body, your mental body, your emotional body, and your energetic body. It also considers your relationship to your generational body, your cultural body, the things that were given to you or modeled or passed down through your caregivers and through the environment in which you were raised. So when I speak about embodiment, I'm looking at what can you do to enhance your relationship to your whole self. And why do we want to do that? What's our buy-in for that? Well, it's beyond just exercise, but fundamentally, studies show that people who participate in daily movement do have a better overall cognitive status. In fact, I was reading a study yesterday from the American Academy of Neurology, and they analyzed a population of 70 and over, and we're looking at the brains of individuals who participated in daily movement from age 70 on versus the brains of individuals who didn't participate in movement, and specifically looking at a population who experienced some level of dementia. And they were able to see that the brains of individuals who were 70 and older who had signs of dementia but participated in daily movement had a slower cognitive decline. In fact, I can probably, if you're interested, I can post the link to the article here if you ever want to check it out. I think it was actually featured on NPR recently, which is how I heard about it. So kind of an interesting study. And again, I'm not just going to be talking about physical movement, but that in and of itself should be a buy-in to start to integrate daily functional movement into your life. So I wanted to think about ways to make this as simple as possible for those of you who this may be new for, but you are motivated to create an integrated embodiment practice. So I was thinking about specific steps to do so. And I broke it down into about 4 steps. So I'm going to share my screen. And I invite you to look at these steps, but also you may want to pull out a pen and a piece of paper to write down. Let me see if I can get the slideshow because it's easier here. Yeah. So if you'd like to write down these steps, I can also probably attach them or send them in an email to be attached to the YouTube video. But honestly, once I start to break it down, it's really the notes that you're going to want to write down. So when looking at an integrated embodiment practice, remember I was promising you that this would realistically integrate into your daily life. So whenever I look at someone's daily life and we're looking at how can we bring in new habits and routines, we kind of look at your week and think about throughout the week, when do these things fit in? So I broke them down into the category of daily. So these are things that you would want to do daily in order to maintain an integrated embodiment practice. 3 times a week, and honestly, that's 3 times a week on average. So anywhere from 2 times a week to about 5 times a week is the range. If you're getting 3 times a week on average, you're doing pretty good. And then things you would do weekly. So when you're looking at what are the things that you could do daily in order to create an embodiment practice, the things that you would want to be considering are slow flow movements, specifically in the morning, no later than an hour after you wake up. And I know for some of you, I said realistic, and you're thinking this probably isn't realistic for you. Even if it's like a 5-minute if you just hit the pause button for 5 minutes and do something that's slow and fluid to create movement into your body, what you're doing is you're starting to break up surface level fascial adhesions that develop overnight when we lay stagnant for anywhere from 6 to 9 hours at night. Even if you're a restless sleeper, even if you wake up and go back to bed, you're still spending periods of time not moving. So what happens is when you wake up with tight fascia. Then when you get out of bed, you go about your day, you are moving through the day with a tight fascial system, which puts a strain on the muscles, which then creates compensation patterns in the body, which then creates pain in the body. So it kind of becomes this cascade effect that can really be eliminated by just adding slow flow movement in the morning. And if I have time, I'll give you a suggestion. But if any one of these things resonate with you, honestly, I try to cram so much in my 15 minutes that sometimes I feel like I don't make sense. So I'm not going to sit here and pick apart every one of these for you as much as I want to. I want to give you a ton of tools. I'm just going to say to you, if you're reading this list and you're like, yes, I want to do this, but I don't know how, just message me. And if we have time at the end, you can ask a question and maybe I can help you. But I do have suggestions for each one of these. In the daily category, at the very least, a tip for you is create a playlist and first thing in the morning, play music. I think not enough of us do just that little thing, and music repatterns the brain. It puts us in a completely different part of our brain that's more flowy, more creative, more fluid. And so that could help to kind of cue you up subconsciously to start moving in the morning. Conversely, at the end of the day, you want to be adding hip stretches in the PM before bed. The reason for that is, especially in our the current culture that we're in with COVID, a lot of us spend a long period of time on our butt. And at one point in one of these talks, I talked about something known as dead butt syndrome. I can't believe that's a thing, but it's actually a thing. So sitting on your pelvic floor for extended periods of time creates contracted states in your pelvis. Your pelvis is your base of support. That is where all your balance centers from. So if you're spending a lot of time sitting or lying or in states of stagnation, then you're creating tension discrepancies in your base of support. Hip stretches at the end of the night. You can lie in bed and just do some gentle stretching. Then we kind of go into the average of 3 times a week category. The things you want to be doing on average of 3 times a week, anywhere from 2 to 5 times a week, is myofascial stretching or self-treatment. How is myofascial stretching different from hip stretches? Why is this a completely different category? Well, myofascial stretching, myo means muscle, and fascia is our connective tissue. Myofascial stretching or self-treatment is designed to create structural change in our connective tissue. The compound effect of our daily life and our, for lack of a better word, poor habits create contracted states in the fascial tissue. If you are not applying long, slow sustained pressure to those contractures in the body to get a release, over time, that's what creates stagnation and leads to chronic pain symptoms. So the myofascial stretching is a way to delay and prevent chronic pain in the body. Myofascial stretching responds best to slow, sustained pressure over an extended period of time. So a stretch for 3 to 5 minutes at minimum versus that hip stretching that I was telling you to do in the PM, which can be about 30 seconds. So that might be something you want to write down. Those hip stretches, you can do each one for about 30 seconds, or I like to say like 4 slow breaths. So that's another great way to get your conscious breath into your embodiment practice, versus myofascial stretching, where one technique is held for 3 to 5 minutes. So do you see the difference between the two? One creates structural change where the other really just maintains flexibility. Another thing you want to add 2 to 5 days a week, or an average of 3 times a week, is balance and core cardiovascular exercise. Please don't hate me. I wish I didn't have to put it in either. As much as we try to avoid exercise, it is imperative that we are getting anywhere from 2 to 5 days a week of intentional cardiovascular exercise, meaning we're getting our heart rate up past resting states. Core cardiovascular exercise, meaning we're getting into the core muscles. The core muscles are both the that natural girdle abdominal muscles in the front, and also the muscles in the back. Okay, that's all core. Standing lunges, squats, those kinds of things are what I'm talking about when I'm talking about core. I'm not a fan of lying on the floor and doing crunches. Please don't do that. And then balance exercises, focusing on the flexibility between the right foot and the left foot, and creating functional balance. Again, if you're not sure what to do, reach out to me and I can help you create a program. This is part of what I do with people. And then lastly, looking at your weekly, what you are doing weekly, you want to be having spiritual check-ins. You want to add spiritual check-ins to your weekly routine. Now, this is at a minimum. For some people, spiritual check-ins are a daily practice. They're non-negotiable daily practice. At the bare minimum, we have a mind-body piece in today's in every mindfulness talk. So if you're just joining this weekly, then you're getting your spiritual check-in. But the reality is, we are not taught, and at least in our Western society and in medicine especially, we're not taught the importance of this. So if you are holding yourself accountable and creating a weekly spiritual check-in, then you're starting to create long-term change to your spiritual system, which then has an effect on long-term change to your physical system. If you're not doing energetic check-ins, spiritual check-ins, the energy can actually start to stagnate and lead to physical symptoms as you age. So how am I doing on time? Okay, so I will wrap here and then open it up to questions if anyone has any questions. And if not, then how much time do I have left? Am I like 3 minutes?
Let me see.
Yep.
Yep.
Yeah, 3 minutes.
Okay, thanks. So I'll stop here and open it up to questions. And if no one has any questions, then I will give you a slow flow movement that you can start to do in the mornings. Okay.
I think I would like a demonstration because I really don't know what those are. So if you could do a few, that'd be good. Thank you.
Absolutely. I have a bunch of questions in here. How many minutes does one need for each to get positive results? Such a good question. So for my linear thinkers, embodiment doesn't work that way. Remember, it's the integration of the whole self. So you need to feel motivated to do this. What I would say, Sheila, is start with that playlist, create a playlist, play it in the morning, and then move until you feel done. I have another question about the balance and exercises. Which balance exercises do you recommend? I recommend exercises that mimic function. I can tell you right now, one of the best balance exercises you can do is a lot of you are in chairs right now. Just put your feet flat on the floor, put your hands on the armrest of the chair. Hopefully you have armrests, and then slowly raise your bottom up off the seat. Balance forward a little bit and see if you can take your hands off. Okay. And then slowly sit back on your chair. So what that's doing is it's mimicking the balance that you need in order to stand and sit functionally. Standing and sitting is one of the first things that we lose when it comes to our balance. And that's honestly where a lot of falls tend to happen. So that could be a good start for you. Another question, read core balance. If you use an electric toothbrush, a friend suggested standing on one foot for the first 2 minutes and change feet for the second. I love that. That's so functional. Please use that. Another thing I learned about when you're brushing your teeth, that's a good time to come down into your breath. Because a lot of times you're standing and looking at a mirror. So as you're brushing your teeth, you can just put one hand on your belly and start to breathe from your belly, having your belly rise and fall as you breathe. So you can do that while standing on one foot. Can we go to YouTube for exercises you recommend? Yes, and actually I was going to suggest that. So for the hip stretches, you can probably find some good ones in there, and balance exercises, you can find some good ones in there as well. As far as core cardio, you may want to work with somebody who specializes in that, because you do want to consider your own body's needs in that case. And so now I'm probably out of time. I am. Sorry.
Nyle,
Maybe
how
I
long
can,
does it take
Come back and do the slow flow.
I was
how long
just
does
going
it
to
take to
suggest
do
that.
the slow flow, Nyle?
It's going to take too much time. I'll come back and teach you the spinal flow. Maybe that can be the very next thing I do.
Okay.
Thank you.
Thank you. Hello, everyone. So it's so interesting that Nyle just shared what they shared, because I had no idea what it was going to be about. But as things always seem to work out in this way, what I'm going to offer is going to be a perfect complement to the information that Nyle just shared. So for those of you who weren't here when Jeanette was sharing my introduction, I'm Larisa Harrington. I am a certified yoga therapist. I'm a somatic trauma practitioner, as well as an executive coach. And so I put all of those things together to be able to support people with their mental, physical, spiritual, and emotional health and well-being. And what I wanted to offer today are some simple mind-body practices that we can easily integrate into our day. So that's what we're going to be doing for the next 30-ish minutes. I'd like to share a couple of different practices and then have some time in between each one to just kind of process and see how each one of them feels. And then also you're welcome to ask questions in the chat during, and I'll leave space at the end for questions as well. So we are going to start using this simple assessment. It's going to be a self-assessment, and I'll go into it a little bit more as we do it, but we're going to be assessing where we are with our stress level, with our pain level, and with mind chatter. And so when we think about our own stress, however you want to assess yourself is fine. It's just going to be an opportunity for us to check in with where we are now, and then to see if any of these practices that we're going to do together support you, and maybe bringing one or all of those numbers down. Maybe some of them will create higher numbers for you. Everything that I teach, everything I do is coming from this foundation of mindfulness, this awareness. So it's paying attention on purpose in the present moment without judgment. So my invitation for you is to try these practices with me and see how they feel for you, and go into it with curiosity. So again, we'll be self-assessing where we are with anxiety, with pain, with mind chatter. So when we think about that physical pain, how much, one scale of 1 to 10, how much we're experiencing, or that mind chatter, it's like how many different thoughts are going on in our head at one time. How does it feel like a lot, which would be a 10, or like 1, where we're very present and focused in the moment. So that's how we'll do the assessment. And then I'll guide you through that before and after each practice that we do. Okay, so any questions for me before we get started with these short practices today? Okay, here we go. So I will invite you right now to just take a couple of deep breaths wherever you are, sitting or
reclining back, standing up, doesn't matter what you're doing or where you are, but start to notice your own body. And notice your own breath, how you're feeling right now in this moment. And check in. And if you would like to write down each of these numbers, you can, but 1 to 10, where are you now with anxiety? 10 being the most anxiety you've ever experienced, 1 being no anxiety at all. Where would you rate yourself? No, there's no right or wrong way to do this self-assessment. 1 to 10, where are you with anxiety? And then 1 to 10, where are you with physical pain? How much physical pain are you experiencing in this moment? 10 being the most, 1 being the least. And then 1 to 10 with mind chatter. How many different thoughts are you aware of? Are you super focused and present in this moment? Or are there lots of things that might happen in the future or things that have happened in the past? Also floating around up there, 1 to 10. All right. So hopefully you got some numbers. You either wrote them down or remember what they are. And we're going to go into this first practice, which is going to be a breath practice. So I'll invite you now to either have your eyes closed or perhaps just soften your gaze and start to notice your own breath, notice your own body breathing itself. And if it's clear and accessible for you to breathe in and out through the nostrils, and I invite you to allow the lips to be gently closed and allow the breath to flow in and out through the nostrils. Just notice that flow of breath. And then begin to lengthen the inhalation and the exhalation, allowing yourself more time for each breath. Noticing what that feels like to breathe in a little slower, a little deeper, a little fuller. This breath awareness. Bring awareness to your abdomen. Where do you feel movement? How do you feel movement as you breathe? And then perhaps allowing your belly to expand a little bit more as you inhale. Maybe taking in a little bit more breath. Notice what that feels like for you. Knowing that there's no good or bad or right or wrong here. It's just a practice, an opportunity to be curious, to notice, to experience. And then explore what breathing even slower feels like for you. That slow, full, deep inhalation and exhalation. Feeling the expansiveness of your inhalation. And then the softening of your exhalation. Allowing your body to soften into the chair or the support that you're on. Softening down a little bit more with each exhalation. Feeling the rise and fall. The expansion and the release. Just noticing what that feels like. Allowing your awareness to stay present with your breath. And if you become distracted by other things, that's okay. We're human. Come back. Notice the distractions and come back. And now just allow your body to breathe itself in whatever way it wants to breathe. Notice the way that feels for you. And notice what's present for you now is thoughts, emotions, ideas, sensations. Notice what's present for you in this moment. And as we begin to bring this short practice to a close, I invite you to check in with your own body and see if there's anything your body needs in this moment, like a particular stretch that might feel good for you, or maybe to even like stand up or get some water. This opportunity to check in, to notice, to honor your body's own needs. What do you need in this moment? And then notice where you are now, 1 to 10, with anxiety. Did anything shift? Did it go up, go down, stay the same? Just making a note of that. And physical pain, 1 to 10, where are you now? And mind chatter. 1 to 10, where are you now? So I'll pause here for a few moments for you to just check in with yourself. Notice what that practice felt like with the breath awareness and lengthened inhalation and exhalation. And then also to open it up if anyone wants to ask a question or share anything about that experience in the chat before we go to the next practice. We'll leave a couple moments now. All right, so let's take one more breath and do some sort of movement, whatever that is for you. You can shake, dance, move your arms around, stand up, move some kind of way. You do that practice that Nyle was talking about earlier of like standing up and then sitting back down. You can do that now too. Come on, big deep breath. Okay. So we are going to go into our next practice now, and this is going to be a practice of self-touch in whatever way you feel comfortable with and doing. But I'm going to invite you to imagine that you have the most like luxurious lotion or oil on your hands as you begin to spread it on your own body, right? So it could be on your face, your neck. You can close your eyes if you want, just allowing your hands to go wherever they're feeling called to go. And really allowing this to be nourishing, loving self-touch in whatever way feels right for you. You can spend a little longer on a specific place. You can just move from your feet all the way up, wherever you feel called to do. But notice how this feels. Notice how this practice of self-touch feels for you, right? So maybe it's just like lovingly putting this magical oil all over your body, or maybe there's a little massage involved. Maybe you're creating a little pressure in certain places. Allow your body to guide you here as you let your hands come wherever they feel safe, comfortable for you to touch on your own body. Maybe there's a place that you just want to hold and create a little bit of loving pressure without moving your hands around. So letting go of worrying about what it's supposed to look like or feel like or be like, and allow your body to guide you through this movement or through this practice. So we'll take a little bit longer here. Gonna lean forward, do a little self-massage here on my legs. I'm feeling really called to rub around my knees. That feels really good for my body. What feels good for you, or what feels needed for you? What feels beneficial for you in this moment? We'll take a little bit longer here with this practice. You can continue doing this seated or standing. Breathing here as you move. And bringing in gratitude for this amazing magical oil or lotion that you're rubbing on your body, feeling gratitude for your own body. Gratitude that you are investing time in yourself during this practice. We'll take a few more breaths here. Notice what this feels like for you. And then check in with yourself and notice, how do you feel? 1 to 10, anxiety. 1 to 10, physical pain. 1 to 10, mind chatter. Notice if anything shifted for you. Seeing here in the chat about frankincense and myrrh. I actually do put that on my body every single day. And I think those are like some of the most expensive oils, but I love them and I put them on every morning and every night. Add it in. I change up my carrier oil. Sometimes I use coconut oil, grapeseed oil, almond oil. But yeah, I love actually oiling up every time I get out of the shower. I get them. We have Mom's Organic Market near me that I get oils from, and I love them. There's so many different places. I also have like doTERRA oils too, but frankincense is super pricey, but I get the good stuff and just use a little bit at a time. But yeah. So anyone else has any questions about that practice, but notice if anything shifted for you. And the idea of all of these practices that I'm offering today are things that you can do in a super short amount of time. Often when we think about self-care, and I'll just share the definition I use for self-care is taking action to preserve or improve your health and well-being, mentally, physically, spiritually, and emotionally. So sometimes we think that self-care has to take a long period of time, but when we can break it down to say, well, what is self-care for me and how can I integrate it into my day? And so sometimes it's these short practices that we can do for ourselves in between meetings or having the morning routine. And I love what Nyle shared earlier with, you know, what you can do as soon as you wake up in the morning or within an hour of waking up, what you can do for yourself on a regular basis, like creating those routines and having those healthy habits, and also the awareness piece of us noticing when we need something. And so I believe that in order for us to truly thrive and feel our best, we need both. We need those habits, those things that we are doing for ourselves on that routine basis. And we also have to learn to pay attention moment to moment to say, oh, right now I need to stretch my body, or right now I need to get some extra water, or I need to get up and go for a walk, or I need to pretend to put some lotion on my body, or I need to breathe with more intention right now, right? It's about being able to be present in the moment for us to acknowledge what we need and then to take action. Because I believe for all of you here, you are people that truly care about others and you care about doing good in the world and taking care of others. And oftentimes when we have that heart of service, we neglect our own selves, or we sacrifice our own health and well-being because we're so focused on taking care of others. And as Jeanette shared, I was in the military for 20 years, and one of our core values was service before self. And for me, it's this idea of service and self, because when we can take care of ourselves in these consistent and loving and nurturing ways, it allows us to be of service for longer, and for us to show up more authentically and to be able to truly use our gifts, because we all have different gifts and different strengths and we're all needed. And so that means we have to take care of ourselves and we have to take care of one another so that we can continue showing up and serving. So hopefully these practices are helpful for you in being able to say, hey, this is something that I can do right now in a short period of time. Seeing here in the chat, touch plus movement really shifts. Yeah, beautiful. Right. So for some of you, you might say, wow, that was amazing, and I can totally do that. And some of you might say that practice was dumb or I hated it. That's okay too. It's just awareness for you to be able to see what is helpful for you. What are these things that you can add into your life, but in a way that doesn't feel overwhelming, in a way that you're not telling yourself, oh, I don't have time for this. because a lot of these things we can do, you can be in a Zoom meeting and be like self-massaging your legs while somebody else is talking, right? You can be driving and do a breath practice. These are things that we can easily add into our life. So we're going to go to this next practice. Take a big deep breath. And this is going to be another breath practice. I'll invite you to right now, just notice how your body is breathing itself. You don't have to control anything. You don't have to fix anything. You don't have to change anything. Notice your body's own breath, the way that your breath feels. And notice the support beneath your body, whether you're sitting straight up, maybe you feel the back of your chair touching you, but notice where your body is connected to another surface. Really allow yourself to feel into that and maybe do a little shifting, a little wiggling. Really feel into that connection. Let your feet connect down. Notice the connection. And then perhaps coming back to stillness with your body, but allow the movement of your breath to expand through the belly and then soften. Let's feel into that rhythm of breath. And then either with your eyes closed or softened, allow your shoulders to start to hunch up towards the ears and then to release down away from the ears, towards the ground. Do that again. Inhale, bring the shoulders up. Exhale, bring the shoulders down. Go at your own pace, bringing the shoulders up and down, flowing with your breath. Let's turn it into a roll. So bring the shoulders up and then pull them back and around and down as you exhale. Moving the shoulders up, around, and down. Okay. My invitation for you now is to make a little bit of noise when you breathe. When you breathe in, allow it to come in through the nostrils. And when you breathe out, this exhale out of the mouth and allow some sort of sound to come out. Going at your own pace, your own breath. Allow your jaw to really open and soften as you exhale. After this last time, let your elbows just be soft, hands resting on your legs or the chair. Feel your body breathing. And allow your body to move in whatever way it's feeling called to move in this moment. Right? Notice how your body feels. Listening to the wisdom of your own body in this moment, what do you notice? Is there anything that your body is sharing with you now, offering you now? Body breathing itself. Noticing the way your breath feels, noticing the way your body feels. And noticing what else is present for you in this moment. Is there anything coming up that feels important to acknowledge? Allowing your breath to flow effortlessly. Feeling the lightness of your breath. Inviting gratitude into this moment for your body's ability to breathe itself. You don't have to force anything or fix anything. Gratitude for the breath, for this moment. And notice now, 1 to 10, where are you now? Anxiety. 1 to 10, where are you now? Physical pain. 1 to 10, where are you now? Mind chatter. Love this comment here in the chat. My body feels happy. Beautiful. And sometimes we do a practice and we notice that our body doesn't feel happy, and we might notice sadness, anger. And it's about acknowledging what's present without judgment, being present with curiosity. Because for many of us, we're not noticing, we're not paying attention. And so, yes, celebrating when we notice things like our body feels happy, and also celebrating when we notice things that might feel uncomfortable. We're celebrating the noticing, the acknowledgement. Reminding ourselves that it's possible for us to do good in the world. It's possible for us to take care of others while also acknowledging our own needs, while also honoring our own needs. So we'll take just a couple more moments to kind of check in with how you're feeling now. See if there's anything you need. I'm going to get a sip of tea here. And again, if anyone wants to share anything in the chat. We're going to do one more practice before we close this up. And it's going to be a little bit of movement. I'm going to take my sweater off. Okay, so we're going to do some chair movement. I'm going to do it, and I will invite you to join me. You do whatever feels right for your body. I'm going to scooch back just a little bit. And let's start with the shoulder roll again. Roll those shoulders up, around, and down. And then I'm going to turn to the side just so you can see a little better. You can stay seated how you want. We're going to move into a seated cat-cow. So we'll tuck the chin towards the chest as we push the back towards the chair. And then lift up as we slide the elbows back, lifting up the chin and the chest, shoulders release down. Move through your back, going with your breath, flowing here. Notice what this movement feels like for you. Maybe exploring a bigger movement. You can see how that feels. Allowing your back to move one more time like this. And then the next time that you're lifted upright, allow your chin to lift. Let your hands slide to hold the bottom or the back of your chair. And we're holding here, lifting up through the chest, the chin, shoulders are releasing down and away. Just breathe. And notice what this expansiveness feels like through the front of your shoulders, your chest, your throat. Allow your jaw to soften. It might feel good to let your head move a bit while you're here. Moving slowly with awareness, only moving in a way that feels safe for you. One more breath. And then allow your head to come back center, allow those arms to release back around. Roll the shoulders. Let your arms reach all the way up. And then slowly let the arms come all the way down. We're going to do a little bit more movement now with the arms extending out to the side. So the palms are facing forward. And then we're wrapping the right arm over the left, tucking down. So that same movement that we just did before, tucking the chin down towards the chest. And then opening and expanding, bringing the arms back out wide, hands come out wide. And then wrap again, left over right. Wrap, tuck, breathe. So feeling that expansion through the back, then opening it up. Okay, so that's the movement. You can go now at your own pace. And I'll invite you to bring in gratitude to this practice. So each time you wrap your arms around your body, bring awareness to gratitude. It could be the same thing again and again that you're focusing on, or you might think of something different that you're grateful for each time you bring your arms around. You can do this seated or standing. breathing as you move. If you forget which arm was on top, it doesn't matter. It's okay. Just move and breathe and stay present in your own body, focusing on your breath and gratitude. Let's flow through this practice 2 more times. And after your last one, or on your last one, you're going to hold whatever arm is on top is okay. Hold. And then do a little side to side release here, hugging it in, giving yourself a big hug and a thank you, maybe even an I love you to yourself. Gratitude that you invested time in yourself. I know that you are busy. There are so many other responsibilities and obligations that we all have, and really celebrating you showing up for yourself, you making time for this practice. Go ahead and let those arms extend all the way back out and up, reach, and slowly release the arms back down. Check in again. Is there anything that your body needs in this moment? Any other stretch that would feel nourishing for your body in this moment? You can do it now. And check in 1 to 10. Anxiety, where are you now? And physical pain, 1 to 10, where are you now? And mind chatter, 1 to 10, where are you now? So take a few breaths to check in. Notice what's present for you. Notice what that experience was like, and then how all of those experiences together impacted you. Did anything shift? Did anything feel helpful? Is there anything that stood out to you? I was like, yeah, this is something I can easily integrate into my day. So just making note of that for yourself. And we are at the top of the hour, and I just want to say thank you so much for sharing in these practices with me, for allowing me this opportunity to be with you and share what I love. And I am going to stay around for a couple minutes. If anyone has any questions, I open it up. Thank you.
Thank you, Larisa. Thank you, Nyle. Wonderful session. I hope everybody will carry it in for upcoming weeks. And I personally hope we will see both of you at some point in near future. Sounds like you both want to come back. So
Absolutely. So if anybody has any questions, they can unmute themselves and just ask.
And somebody during the meeting pointed out that I recorded a wrong video. So I'm going to repost the link to the correct YouTube video for the metformin study. And I want to personally thank Elisa for finding this gem. I did not find it. She picked it up and emailed it to me. And by the way, let that be an encouragement for you, that if you find something that you think is particularly interesting for everybody, send it to me, and it may turn into just like this, a YouTube video. So thank you. See everybody next Friday.
Okay.
And
Have a wonderful weekend. Oh, you are going to be giving the wellness talk, and Nina Paul will be leading the mind body practice.
Very good. Very good.
Bye, everyone.
Everybody.